If you wake up in the morning with a headache, or if you find that you get a headache when you stare down at your computer screen or your phone all day, then this video is for you. You could be suffering from cervicogenic headache. So this is a really common complaint that I see in pain management. Patients come in and say that they have a really bad, dull, aching headache that starts at the base of their scalp on one side and radiates up to their ear or the back of their skull to their eye. So there's several things that can cause this kind of headache. One of the more common reasons we see is tension in the muscles that support the neck, and also arthritis in the upper joints of the spine called the cervical facet joints, especially after whiplash injuries. Another reason why we're seeing a lot more cases of cervicogenic headache is because of tech neck. So this is where people are staring down at their cell phone all day, and slowly but surely they're just looking down, and it creates a lot of strain and pressure on the back of the neck. So how do we treat this type of pain? Well, there's lots of different options. You can start with easy things like posture adjustments, getting a stand-up desk, making sure that you're trying to avoid looking down at your phone constantly. You can go to physical therapy and learn stretches to help ease the tension in the muscles. Massage can be a great option. Adjusting the pillow that you sleep with at night. Heat can be really helpful. And then sometimes we'll move on to medications like anti-inflammatories, muscle relaxants, and then even medications for nerve pain if we think that there's a nerve component where the nerves in the back of the skull are getting irritated, like amitriptyline or gabapentin. And then if patients still don't get relief, sometimes we'll consider what's called a cervical medial branch block or ablation, where we put numbing medicine around the nerves that feed the joints in the neck. And if patients get temporary relief, then we do what's called an ablation procedure, where we can actually burn or deactivate those nerves. If you suffer with this issue, I hope this video helps, and I'm happy to answer questions in the comments.